Hey everybody, what's going on? Dr. Chad Woolner here.
And Dr. Buddy Allen.
And this is episode 2 of the Health Fundamentals podcast. On today's episode, we're going to be discussing the question, should you get stem cell therapy? So let's get started. You're listening to the Health Fundamentals podcast. I'm Dr. Chad Woolner.
And I'm Dr. Buddy Allen. And this show is about giving you the simple but powerful cutting-edge tools you need to change your health and your life.
So sit back and enjoy the show as we show you the path to your best life down to a science. So hey everybody, hope you guys are having an awesome day. What we wanted to dive into on this episode is discussing stem cell therapy. It's a really hot topic right now, and we wanted to kind of dive in and perhaps give you a little bit more information and lay of the land. In general, we'll kind of start by talking about regenerative medicine, kind of step up just a little bit. We'll talk a little bit more broad and kind of dive in a little bit more specific, but it's no mystery or surprise to people that anymore these days, there's a lot of information that people have to filter through. And when it comes to stem cell therapy, it's a really hot topic right now that people are discussing. And when it comes to the information that's available to us, it's kind of a double-edged sword, right? There's, you had said, the issue back in the day was not enough information. Nowadays it's kind of information overload.
You bet.
And so where do we even begin with all this information that's in front of us? I'm sure, unless you've been living under a rock, if you've looked up stem cell therapy, you've probably seen all sorts of things that have been said about it. Stem cell therapy is good. No, stem cell therapy is bad. It works. It doesn't work. It's even dangerous. So where do we even begin this process of filtering that information?
It kind of goes back to one of our very first seminars that we did when we were talking about stem cells. And it kind of goes down to, there was this medical doctor, this retired, I think he was a neurosurgeon, he had said. He was there with his girlfriend. And he basically had mentioned, at the end of the talk that we did, he was like, man, you guys need to sell this way harder to people, because the days of cutting out joints and replacing them, he's like, that's archaic. That's old medicine. And it kind of caught me off guard, because we were fairly new into this, and I was like, really, So again, you're talking about these varying degrees of belief in it. This doctor had it done himself, and he was
such
so
a huge
impressed
proponent,
by yes. And then obviously, he's seen over the years both the good and the bad that maybe comes from surgery. And the beautiful thing with regenerative medicine in general is we're tapping into one of those fundamental things that we talked about, is our body's innate ability to heal itself, right? And we're using something to help accelerate that, or focus that attention in one area or multiple areas even at times. So to kind of dive into that and really figure out where, my goodness, how do you do it? Because you start going and you look at research. We always like to go to the tried and true. What does the research say? Yeah. And the sad part of that is, in just recent days, literally in the last few weeks, there was Duke University settling some $114 million settlement for falsifying medical research for their, so they could get grants and what have you. And the sad part is I'm sure they did lots of good research, and I'm sure that very valid research, and there's lots of other people doing the same thing. But now we have this
gross breach of trust.
Yes, absolutely.
Huge breach of trust there. And so the problem there is that, what do you believe? Who do you believe? And that can be kind of a frightening prospect for a lot of people, because I think for a lot of people, they take their cues from the academic circles or the traditional medical circles. And again, this isn't to say that all research is bogus or fraudulent or anything like that. But the simple fact is that so long as human beings are conducting research, there's always the potential for bias to enter.
Flaws.
There was one key that I cued into in our research methodologies class years ago. It was that you can find bias in just about everything, right? And so it's, again, don't misunderstand. This isn't saying you can't believe the research. What we're simply trying to say is that you can't necessarily put your entire
That's
focus.
one piece. That is only one piece.
Yeah. You don't want to put all of your proverbial eggs in that single basket, in terms of looking at the literature. Literature is certainly important. You want to at least maybe begin there and kind of look and see what it says. What you're likely to find is to some extent a mixed bag. I think it's pretty rare that you would find a universal consensus. Sometimes you find more general consensus. Is that the plural for consensus? Consenses. You'll find kind of these general beliefs or general conclusions, but it's pretty rare that you would find any sort of a universal statement. And again, that's kind of implied in the nature of science itself, right? It's ever learning, right?
And unfortunately, we're always very skeptical to new and changing things.
Absolutely.
Because we've been doing something for so many years, and we consider this to be this is what you do.
This is the way you do it.
And now all of a sudden, when that's challenged, I would say our human response is, whoa, wait a second.
Yeah,
we're gonna kind of put up a little barrier there, and until we have ample and maybe even overwhelming research or evidence that that's the case, we're going to kind of dig our heels in just a little bit.
Absolutely. So if we're not going to put everything all into that basket of the literature, what else do we look at?
Frequently, in fact, you've said this lots of times, and I 100% agree, is you have to look back at history and kind of look, is there historical precedents there?
Yeah.
Is this something that's been done in the past? Is there, and even beyond that does it make sense?
Does it make sense? Is there historical precedent? And then don't ever discount or dismiss clinical evidence right in front of us, especially if it's a clinic or a procedure that has been used for quite some time. There's merit to that, and especially when we look at the idea that hopefully you're starting to get from this is that we want to look at multiple sources of evidence to then start to see a pattern emerge is really the whole idea. When a patient comes through the door, we'll use the same analogy. One of the things that we were taught in terms of developing a diagnosis for a patient is you don't want to rely entirely on one single test, whether it be an orthopedic or a neurological test. That's not the way it's done. If you go to any doctor who's doing it right, be it a medical doctor, a chiropractor, a physical therapist, for heaven's sake, a dentist, you're typically going to find, at least the ones that are doing a thorough job, they're going to run a series of tests. They may look at blood work. They may do an evaluation of your muscles, your bones, your joints, your nervous system. They might look at a variety of these things and do these tests, and then ultimately look and see kind of what pattern has emerged as a result of that. And that's what's ultimately going to steer them in that direction. Then obviously, it goes without saying, the patient history is going to be a big part of that puzzle as well, right? So the idea being is that we don't want to put our entirely put everything into one thing. We want to look for the pattern is really what we want to do. So that's at least a good place to kind of start. And so we kind of already introduced this concept of regenerative medicine. The premise behind regenerative medicine is that what we're trying to do is tap into and allow the body to heal itself. Something that you had said prior to us doing this show here, is it's been our hope for quite some time now for patients to understand the true nature of procedures like stem cell therapy. Far too often, what do people think of stem cell therapy that we find, right? What is it?
They think, and actually more hope, that it's like that magic bullet.
Yeah.
All right. They hope that it's just this is the missing piece that I've been missing for all these years, and as soon as I plug it in, everything's going to be better.
Yeah. How should patients view procedures or options like stem cell therapy? What should they ideally be focused on?
The reality is while they are incredible, and they, from my own personal experience, it made a huge difference for me. But more often than not, or more appropriately, they should be looking at as more of a catalyst to, again, help their body start healing.
Ignite that spark,
and in a very localized area to focus our body's attention to healing.
And I think most people can get on board with this idea that, barring those few rare exceptions where, and I shouldn't say rare, but less common, we'll say, exceptions to where it's been an acute injury, right? They slip, they fall, sports injury, et cetera, things like that. More often than not, most of the cases that we see for stem cell therapy, we'll say joint pain cases, are problems that are chronic in nature that have developed over time, right? And so most people could, if you really walk through with them, could tell you how they got there. It's just been a slow and steady process. And the problem is that most people would know how to get back to a state of health if they could, meaning, you got to get out and exercise, you got to get moving, you got to eat right, all those things. But unfortunately, for a lot of those things, it's a catch-22 in the sense that I would get out and run. I would get out and exercise if it weren't for the fact that it would flare it up too much and create more pain. And then all of a sudden, they're laid up for another week, and that kills the motivation that much more, and they sink that much further. So in terms of this idea of it being a catalyst, really what we're trying to help patients understand is use this as a golden opportunity, as a window that opens, or a new door that opens for you, that would allow you the process to begin doing those things that will allow your body to heal itself. Regular exercise, making those necessary dietary changes in your life, and or other lifestyle modifications that need to be made.
There's something that we've kind of left out of here that you frequently mention that is a really critical part about anybody getting better, and it is hope.
Yeah.
All right. So many people, when they've had a chronic condition for, and we see people all the time, this has been here for 15 years, 20 years, I've had issues. And literally they're like, I've done injections, I've done steroids, I've done, and nothing seems to help. I've lost weight, and you name it. They're like, I've done it and it doesn't help. But to say, listen, what we're finding is, conditions like yours respond incredibly well to these types of injections.
Yeah.
And so literally that little bit of hope and desire is
the catalyst.
Yeah, it's hugely important.
It's that initial spark, right?
Absolutely.
So okay. So let's dive in a little bit more deep, under that umbrella of regenerative medicine. What are some of the things or procedures that patients might encounter? Now, obviously, let's start with stem cell therapy.
Right at the top of the list.
Right. So in general, but before we dive into that, let's just understand, like, the way the body, more specifically, the way the body begins the healing process is utilizing its own stem cells, right? Mm-hmm. Every cell in your body at one point in time was a stem cell. Think of a stem cell as the template, right? That's the template that your body uses, right? So whether it be your skin, your bones, your cartilage, your eyes, your nerves, your blood, everything starts off as a stem cell, this blank template that then grows up, quote unquote, to become whatever specific cell type that it needs to be part of the tissues that make up the various organ systems and or cells of our body, right? So stem cell therapy, what's the story behind stem cell therapy in a nutshell for people to understand?
Stem cell therapy is basically getting a cluster of stem cells together, in an injection, and putting them into in a condensed area, localized area to stimulate healing in that spot, right? So
so where do clinics that are utilizing stem cell therapy, where do they get stem cells from?
So there's a few different ways of gathering those. One of those is from your own fat cells, so they'll
or bone,
or from they'll basically drill into the marrow of the bone and pull them out, and then there's a process of spinning them out and growing them, exactly. And then a third way is from like umbilical cords. All right, cord blood has stem cells in there that are undifferentiated. They're basically, they haven't been marked, so they can be put in anybody without any adverse effects of rejection or things like that. And then again, those do an incredible job at helping people to recover from different arthritic conditions.
And you're going to find various camps that are going to promote, no, this is the best way to do it, this other way you shouldn't do, or vice versa. When you're deriving or when you're pulling stem cells from your own body, the term you'll hear or see is autologous. These are autologous stem cells coming from your own body. There's been a ton of research on those. In fact, I would say the research is really compelling, saying that that's a good way to go. However, there's also a ton of research on the other end using stem cells from, say, umbilical cord or umbilical cord blood, or we'll just say cord-related products that have been presented. The biggest thing that really I would tell patients is kind of two things. Number one, look at the company that they're using. And looking at either looking at the company and seeing what kind of third-party data they have to validate
how many live cells.
Yeah, live cells. And then also, I think just as important, if not more important, is look at the clinical experience they've had, right?
Sure.
How long has this company been around? How long has this clinic been doing stem cell procedures? What are the patients experiencing? Don't dismiss that. That's huge. That's really, really important. And so that's kind of in a nutshell, I think. Stem cell therapy. What are some of the other regenerative medicine techniques?
There are things like PRP, which is platelet-rich plasma, where they draw your blood out, spin your platelets, pull them out, put them in the joint. That kind of creates more of an inflammatory response that, again, probably draws your own stem cells or other healing agents to the area. Those can be helpful as well. Generally, that takes multiple treatments. There are things like prolotherapies. There are other amniotic products, actually, which...
let's back up real quick. Prolotherapy, describe that for patients who may
Prolotherapy is basically injecting something into a joint that creates a ton of inflammation, which, again, inflammation, especially localized.
It's designed to irritate the joint. And there's a method to the madness. There's a reason for that, and that is that ultimately what we want to do is we want to stimulate some new inflammation to hopefully begin that process of
healing.
That repair process. Inflammation kind of takes a bad rap.
Yes.
People think automatically inflammation is a bad thing, and inflammation is such a contextual conversation. Chronic long-term inflammation, not a good thing.
Not good,
but acute localized inflammation with the intent or focus of beginning a healing cascade or that healing process is actually a very, very good thing. So that kind of answers prolotherapy. And then you were talking about amniotic products.
Yes, amniotic products are basically kind of like the stem cell injection minus the live stem cells.
And how do they derive the amniotic? Where do they get the amniotic products from?
So they'll take those from the cord as well as the amniotic membrane,
placenta.
The placenta.
Right? They're derived from a placenta. We're not using any fetal tissue or anything like that, and they process these in very stringent, controlled environments.
Absolutely.
To where what you're getting are pure cells that are undifferentiated. They haven't received any sort of marking or any sort of labeling saying that they belong to a specific individual, which means that the term is they're immune privileged. That means if you inject them into any human being, the body is not going to recognize them as foreign. It's not going to create any sort of an immune response or anything like that, create any sort of reaction to those. And the amniotic product that we use has been used over 1 million times. They've had over 1 million procedures that have been performed with this. So there's overwhelming evidence there showing it's extremely safe, it's extremely effective. And for us, one of the reasons why we offer this for our patients here in our community is it's a really affordable option for people. For a lot of people, stem cell therapy, as amazing as it is, it's just not affordable for a lot of people. And so what we've done is we've kind of opened the door to provide them with this regenerative procedure at a fraction of the cost of stem cell therapy. And so it gets great results. The cool thing Buddy kind of already alluded to, maybe you can tell him a little bit about your experience utilizing, because Buddy is kind of the walking poster child for both stem cell therapy and amniotic therapy.
So I initially did an amniotic or a stem cell injection. Golly, it's been a couple years ago now. Prior to that, I had injured my knee doing something at CrossFit, and for well over a year, I want to say it was almost a year and a half, I was wearing knee braces. I was, I'd leave the gym just hobbling. I couldn't kneel down. I couldn't pull my heel to my butt. I had a limited range of motion, and I had tried other therapies, and I was doing other things that just kind of weren't getting me. I wasn't getting anywhere. Finally, I got an injection into my knee of the stem cells, and after about a month, I was like, I one day forgot to wear my knee brace at the gym, and I'm like, wait, my knee feels pretty good. And long story short is, since then, I've run 2 half marathons. I've done I've done 3 Spartans actually, and basically, in the Spartans, you're crawling around your hands and knees under barbed wire on rough, rocky soil, and it's like, and I did just fine, right? And my knees, I mean, I can kneel down, I can touch my heel to my butt. Like, it's good. It's really good. Loved it. You know, it's been amazing for me. And then, just, you know, and not too long ago,
so about 4 months ago.
Yeah. And I injured again at CrossFit doing pull-ups. I hurt I actually had called a slap tear, which is basically kind of a labral tear
of the cartilage in the shoulder.
Exactly. So that was well over a year of dealing with that. And I tried the amniotic product that we're using now, and I have every bit as good a results from that as I did with the stem cells.
And that's honestly what we're seeing with our patients as well, is they're getting pretty darn comparable results using the amniotic product. Maybe describe kind of how the amniotic product works.
Amniotic product, the beautiful thing about it is it comes dehydrated. There are a bunch of different growth factors in there, and so when the doc, basically they rehydrate it with saline, they draw it up in the syringe, and then they put it into the joint capsule. And then, you know, for the first 24 hours for me, my shoulder was real sore. Yeah. But within, you know, with just...
And that's, you prepare yourself with a lot of these regenerative therapies. Oh, sure. One of the common things is because inflammation is the kind of secret or key to this process, there is going to be some soreness for the first day, sometimes even as many. We've seen patients for the first week, sometimes it can be pretty sore. But the way that the amniotic product works is it really acts like, the term that we use to help describe it is it acts like a stem cell magnet. Even though we're not injecting live stem cells to that area, what's happening is the process that takes place in that joint is such that it begins attracting the body's own stem cells to begin that repair process. And so it's pretty incredible.
That's awesome.
Yeah.
Awesome.
So hopefully the answer is clear. The conclusion originally, the question that we pose is, should you get stem cell therapy? Assuming you're a candidate for this procedure, the answer is a resounding yes. Absolutely. It is such an incredible option with, such a heavy skewed, risk to benefit ratio skewed in favor of the benefits. The benefits far outweigh the risks. Huge in this area, and especially if you're somebody that's on the fence considering the possibility of surgery, either joint replacement or some other type of surgery. Explore this procedure first before you do that. See if you're a candidate, see if it's a viable option for you, and if it is, absolutely incredible. Anything you want to add?
No, other than the fact that, like, I would do this again and again. I mean, with the results I've had, and I think it's, like you said, because of the benefits far outweigh the risks that are involved here. You're not causing any long-term trauma of any kind. Yeah. So I would do this again and again and again.
And again, we're going to kind of, I want to circle back on one subject that we kind of just hit on, but I want to just end on this emphasis that the idea again is this isn't a magic bullet. It's not intended to be some, Harry Potter wizardry here that you can rely on to just fix everything for you. At the end of the day, the operative process is that the body heals itself. There are certain things that we do or need to do to assist and help the body in that process. Obviously, we talked about it. Most of these are lifestyle factors that aren't really, shouldn't come as a huge surprise to people. Consistent, regular exercise, consistency with fueling yourself properly. The things that we talk about as these 5 fundamentals of health that we talk about, those are the things. And so view regenerative medicine as the catalyst. That's really kind of the bottom line. View it as the catalyst in allowing you to really get to the best place possible for you to live your best life ever. That's really the hope. Obviously this show is helping you, kind of showing you through an evidence-based lens how to live your best life possible. So hopefully this has been valuable to you guys. Any final thoughts that you wanted to add in to the show?
Just join us on our next episode.
Yeah, we're excited to share it with you guys, and we'll talk to you later. Thanks for listening to the Health Fundamentals Podcast. Be sure to subscribe so that you stay in the loop and in the know with all of the cutting-edge health information that we share. If you know other people that could benefit from this information, please share it with them as well. Also, be sure to give us a review. These really help us to ultimately help more people. Last but not least, if you have questions that you want answered live on the show, or if you have ideas for topics that you would like us to cover, please shoot us an email and let us know at info@thehealthfundamentals.com.